Candidiasis. Candidiasis is a fungal infection commonly caused by Candida albicans, usually occurring in the mouth and pharynx, but it also occurs in the esophagus and can become a source of systemic dissemination, particularly in high-risk patients. Pathophysiology and etiology, more common with immunosuppression from disease states or treatment regimens. Example, HIV infection, chemotherapy, corticosteroids. Altered oral environment from loss of epithelial layer, antibiotic therapy, pre-existing infections, poor oral hygiene or nutritional status, and wearing dentures. Clinical manifestations, oral discomfort, burning, altered taste, erythema. White raised painless flakes, loosely adherent, and possible spread to the esophagus with pain on swallowing and chest pain. Diagnostic evaluation, microscopic smear of plaques shows characteristic hype. Fungal culture positive for Candida albicans. Occasionally, biopsy of lesions may be necessary to rule out leukoplakia, that is pre-malignant plaques. Management, topical antifungal agents in oral rinses, troughs, and creams such as clotrimazole or nystatin. Systemic treatment is indicated if topical agents fail or for esophageal cases with fluconazole, ketoconazole, or amphotericin B. Analgesics for pain and oral prostheses are also treated to avoid harboring and reintroducing infection. Complications, candidal infection throughout the gastrointestinal tract and candidal sepsis. Nursing interventions must include attaining adequate nutrition, ensuring adequate therapy, patient education on oral examination, signs and symptoms to observe, teach patient to avoid highly seasoned food, extremes in temperature, alcoholic beverages, and smoking, all of which irritate the oral mucosa. Encourage good oral hygiene. Oral prosthesis should be soaked in antifungal solution each night during treatment. And encourage patient on long-term systemic antifungal therapy to follow up for liver function test monitoring as directed. Expected outcome, adequate intake of fluids and soft foods as evidenced by stable body weight and lack of orthostasis. Switches of oral suspension for 10 minutes before spitting or swallowing. Thank you.